everyone, Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower anteriors, canine to canine, and the lower right first molar. On the panoramic view, you can very clearly see we've got bone loss and tooth loss in the lower anterior quadrant, and we have a missing lower right first molar. Coming to the lower right first molar, this is the transaxial view. We've got D2 quality bone, good healthy bone for an implant. We've got 5.5 mm of ridge width with approximately 12 millimeters of ridge height. If we go slightly deeper, approximately 2 millimeters deeper, so then our ridge width will become 7.5 millimeters. So a deeper implant will have would have good bone support around the collar. Now moving to the lower right canine, as you can see, the patient has significant periodontal disease, and here also we can very clearly see we don't have periapical radiolucencies around the canine, but we do have significant bone loss lingually as well as buccally around the canine and the lower anteriors. This is the lower right lateral incisor. Again, you can see we have calculus here, we've got significant bone loss here, we've got periapical radiolucency here. So the lower right lateral incisor is probably grade 3 or grade 2 mobile and has significant bone loss and no bone coverage. If this is extracted, we do have approximately 6 millimeters of ridge width with 9 millimeters of ridge height if an implant needs to be placed here. Moving to the central incisor in the lower right quadrant. There we go. Again, no buccal cortical plate, no cortical plate on the buccal side, no cortical plate on the lingual side. Very significant tooth loss, very dense bone here, with approximately 5 millimeters of width with 8 millimeters of height. Moving to the lower central incisor region, lower left. Here we again don't have any significant bone crestally, but we have approximately 6 millimeters of width with 10 millimeters of height. Slightly better bone quality on the lower left central incisor region. The lower left lateral incisor again has significant bone loss around it. We've got calculus here, we've got bone loss here, we've got bone loss in the buccal aspect as well. So significant bone loss and a periapical radiolucency. Moving to the lower right canine, good bone support on the lingual, better than the lower right side. The lower left canine also has calculus here, also has bone loss here, but not as significant as in the lower right canine. No periapical radiolucencies can be seen. Now moving to the axial view, which is basically the top to bottom view. On the axial view, we will be able to show you the bone quality. So here you can see significant calculus on the linguals, no bone, and then we move to very close to the apex is where we have some bone, but the laterals have zero bone. Canine has good bone support from the middle to the lower 1/3. And there's very excellent bone for the molar on the right hand side. Thank you very much.